Hi, I'm Mrs. Katie Spear. I'm a registered nurse and I work for the LVN program at Amarillo College. And I'm going to discuss how we do newborn injections. Right after birth, we wait a couple hours and we give every infant in Texas needs to receive erythromycin eye ointment. They do try and do this within 1 hour after birth to prevent infections during the birth process. So we take and we check the ointment, and it's erythromycin ophthalmic ointment, and we do 1 ribbon in both eyes. We take the infant, and it usually you hold the head still, and you would give it from the inner eye to the outer, and then you close it, and then you do the other eye and rub it in. You don't wash this off for an hour or so that it has time to absorb. Then almost all the infants have to receive hepatitis B injection, and there are 2 different types, and it will be on the order. We always check the orders first, the physician orders, then you come and check the infant band with the orders, and you have to scan the medication. And it is hepatitis B. It's usually 0.5 milliliters, 5 milligrams, and we always give it in the right thigh. We give it in the vastus lateralis. Some of the nurses write anterior thigh, but you hold the thigh very hard, very firm in place, and you see the muscle very well. When you give it, you always give IM, and you hold it and inject, and always remember to withdraw and make sure you don't receive any blood, and then you go ahead and inject it. Then you use a cotton swab and hold it in place until it quits bleeding. Then we give vitamin K, which comes in an ampule, and it is 1 milligram, and we give it to help with the infant's blood clotting, and it's in an ampule, so you will need an alcohol swab and wrapper, and hold it and break the ampule away and withdraw it with a filtered needle so that you don't get any glass in it. Then you change the needle to a regular needle and get all the air out, and then we give it in the left thigh. So you do it in the same procedure. You inject, withdraw, and make sure there's no blood, and go ahead and inject. Then you go ahead and hold it. We don't use Band-Aids, we just hold pressure with the cotton swab. And if the parents are in there, we go ahead and explain what we're doing and why we give these.